I don't remember the name of the first patient that I ever saw in my training clinic back in graduate school, but I do remember the day that we first broke through her resistance and got to the real deep stuff. It's an example that I continue to use in therapy to this day, and it's a very vivid moment that sticks in my head. I promise you, she is feeling the impact of your work together as well. As a therapist, it's not every day that you find somebody who you connect so well with as a client and that you're able to work with for a long enough time to see a substantial change. So that's amazing. Grief does not require death. Grief simply requires the end of something. For example, many people grieve after a breakup. Nobody actually dies in that situation typically, but a real grief process happens. Fatigue and depression isn't just feeling tired, like you had a long day at work and you feel tired. It is this overwhelming lack of energy that is very physically impactful. It's a type of bone tired, almost soul tired, where you only know what that feels like if you've been there before. At least 25% of people with major depression also experience what's called dissociation. It doesn't have to be all at once, but pick one thing, maybe two things, and start to go with them. Maybe you get in therapy and you also go to a self-help group, or maybe you decide to take medication and you start really reading books and educating yourself about this. Even if that's literally just flinging open the front door and lying on the ground right on your porch or outside of your house, take that one step. And with that, hopefully you can interrupt that pattern. You could put a break to that pattern, and that will allow you to do the next thing. All right. Hello, everybody. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff. Thank you for joining me today. It has been a while since I've done a question and answer episode, so that's what I'm going to do today. I have two really good questions for the show. If you would like to send me in a question, please send me an email to duffthepsych@gmail.com, or you can use the contact form on my website, duffthepsych.com. I've had a lot of really great interviews recently, so I'm excited to be able to jump in and actually answer a question that you guys have asked. Please don't forget to subscribe wherever you watch or listen, and if you would like to rate the show, give it a review, I would really, really appreciate it. But all that said, let's go ahead and jump into the first question. First question reads, hey, I have a question which I'd like to ask/request on the podcast. Basically, how to cope with transference or ending therapy. I've been doing therapy for anorexia and have finished therapy. However, I've spent the last week crying endlessly, feeling overwhelmed about the fact that I'll never be able to speak to my therapist again. She was the first person who made me feel understood, safe, and comfortable opening up about my problems. And she's everything I ever want to be and a massive role model to me. I just feel so lost and I don't know how to cope without being able to update her on my life each week. I understand professional boundaries and that therapy was always going to end, but she's the most amazing therapist and I feel like I'm grieving the loss of someone who's still alive, as well as being sad about the fact that she'll probably forget about me in a few years while I'll never ever forget her. Well, thank you very much for writing in. First off, I want to say I'm so proud of you for approaching your issues and sticking with therapy. Eating disorders can be such a difficult thing to get help for because they feel extremely private. And at a certain level, it can feel like you're losing something by treating them, like you're giving away a piece of yourself, something that you've held onto for a very long time. So first off, bravo to you. I think it's amazing what you've been able to do. And I hope that you're really doing well in that dimension. But regardless of the reason for discontinuing therapy, it is absolutely allowed to be hard. There are a lot of different reasons that you might stop therapy. In some cases, the therapy was intended to end, as you mentioned in the question. Sometimes that's because it's a certain number of sessions and you've maybe met those guidelines, or maybe your therapist moved somewhere or decided to make a change in their career. Maybe you've just graduated, meaning you've reached the end of what they can help you with on this leg of your journey. A lot of different reasons. In this past year, I discontinued with almost half of my therapy patients because I made a really important shift in my career where I'm looking more at doing more testing, more supervision of clinical interns, outreach, things like that in my sort of day job. And so I had to end with a lot of my therapy patients that I've been working with for quite some time so that I can make room for that shift in this new role that I have. And most of these patients did have a reaction to the idea of me stopping therapy with them. So it's totally normal to be sad about this. It's totally normal to feel whatever you feel about this. Now, for you, the situation is amplified a bit further. Not only did you have a good therapist, but this is the first person essentially that you've been able to really connect with and that you were able to open up about your issues with. It's super amazing that you've been able to do that you've had such a change with the therapist. And I promise you, she is feeling the impact of your work together as well. As a therapist, it's not every day that you find somebody who you connect so well with as a client and that you're able to work with for a long enough time to see a substantial change. So that's amazing. One of the things that you wrote in your question at the end was that she'll probably forget about you in time, but you'll never forget her. Not that it particularly matters because, we can never know how well we're remembered by others, but I would doubt it. I would really doubt if she just forgot you, in a matter of a year or two. Even if she forgets the specifics about your case, meaning like what your mom's name was or when your first episode of XYZ eating behavior was, the experience that we were able to have together will forever influence the way that she works and understands her clients moving forward. For example, I don't remember the name of the first patient that I ever saw in my training clinic back in graduate school, but I do remember the day that we first broke through her resistance and got to the real deep stuff. It's an example that I continue to use in therapy to this day, and it's a very vivid moment that sticks in my head. And I have that for many clients that I've worked with. So don't be surprised if it actually turns out that you were instrumental in some way with the therapist's work that she does in the future. You won't exactly get to know that, but it's a possibility. Like I said, I have a lot of examples of that myself. It's not tit for tat, and therapy is a somewhat imbalanced relationship by nature. It can't be purely on the same footing because it's a therapeutic relationship, not a friendship, right? But just please don't assume that you're going to be easily forgotten or that you didn't make an impact as well. Now, you mentioned transference in your question. Transference is a term that we use in psychology, especially in more kind of psychoanalytic therapy. This would be stemming from Freud and other psychoanalysts. And it refers technically to when somebody redirects feelings and emotions from one person to another. So this is often from past relationships that a person has had onto their therapist. So for instance, some people might transfer parental feelings onto their therapist. The flip side of this is what's called countertransference. And that's when the therapist projects their own personal feelings onto the client. For instance, like I might have very nurturing feelings towards somebody if they remind me of a close friend that I've had, right? And those are not bad things, transference and countertransference. As a therapist, your job is to be aware of that and to work within that, because sometimes somebody transferring their parental feelings onto you gives you really fertile ground to work with in terms of working through parental issues. So it's just something to be aware of. In your case, though, I'm not totally sure that transference is occurring here. It could be the case, but it doesn't have to be for what you're feeling to be valid. You don't have to be having, a transference sort of situation to feel the way that you do. It sounds to me that you might simply be experiencing grief. In fact, you actually mentioned this at the end of your question. You said it feels like you're grieving for somebody that's still alive. And I think you might be right on track with that. Grief does not require death. Grief simply requires the end of something. For example, many people grieve after a breakup. Nobody actually dies in that situation typically, but a real grief process happens. Mourning happens. And I think what you're experiencing right now is totally normal. When I think back to romantic breakups that I've been through, in the immediate aftermath, I felt absolutely wrecked and distraught. I said, I posted embarrassing things that I kind of wish I could go back in time and erase from history. All those things happened. So it's normal to be devastated when somebody that made such an impact on your life and that you shared such emotional intimacy with is no longer there, regardless of what type of relationship it is, professional, romantic, friendship, family member. Please don't think that you're doing something wrong here. But beyond that, beyond just normalizing your experience and reassuring you that you're not doing anything wrong, we should talk about what you can do from here. First things first, you need some time. I don't want to compare this too directly to a romantic relationship, but there are some similarities in terms of somebody you're in a relationship with. You're often sharing that same vulnerability and emotional intimacy with. So yeah, you need to allow yourself to feel shitty if that's what you feel. Just like a breakup, in time, you're going to feel less shitty. And I hate to say it, but time does really, really help. In the meantime, while that's taking place, you are allowed to grieve. It's sad that this chapter of your life and your therapeutic journey, your mental health journey, it's sad that this is closed. And it's had an impact on you. That's beautiful, but it is sad that this is over now. When I'm grieving, like you are in this situation, it helps me to take a step back and consider the scale, right? So let's say, for example, I'm pulling a random place out of my hat, but let's say that you live in London. It's estimated that over 10,000 people provide psychotherapy in London alone, right? So there's 10,000 people that are licensed to provide therapy in just London. So it's easy to assume that you may never find somebody who gets you the way that your therapist did. But when you pull back and think of the scale, is that really reasonable when you've actually only had experience with 0.01% of the therapists in your region alone, let alone the broader region? So chances are you haven't even found the best therapist that you will ever work with yet. As humans, we're really, really drawn to what we call primacy in recency. And that is meaning we put a lot of value and remember the first examples of something and the most recent examples of something. I'm not trying to undervalue your therapist or the work that you did with her, but 20 years from now, she very well may be a fond memory for being the first person that you were really able to open up to, but she may not even be the most impactful therapist that you work with in your lifetime. So all in all, I just want to encourage you to be kind to yourself. It's allowed to be painful. It's allowed to be sad. You will feel better in time. And you'll also have opportunities to grow in different and profound ways with other people if you choose to do so. And that's all part of the process. So I appreciate you writing in. I feel like there's probably other people who are in a similar boat, slightly different personal details, but that idea of losing a therapist and having that grief and that confusion about how to move forward from it, what to do with all those feelings. So I hope these thoughts were helpful to you, and best of luck. All right, and on to the second question. It reads, I'm wondering if you've done or would consider doing an episode on the physical symptoms of depression. As somebody who has had many MDD, so major depressive disorder episodes, and use NSSI to cope, meaning non-suicidal self-injury, I feel like there's very little information on how depression manifests physically. Most of the information available online just says that you can feel tired and get headaches. I think more information on this would make myself and others feel less alone. Thanks for all you do. So yes, thank you for writing in. The term you mentioned, I want to define that. So you said NSSI, and as I mentioned, I believe that stands for non-suicidal self-injury, unless I'm understanding incorrectly. I hope not. But yeah, NSSI is stuff like any self-injury, cutting, scratching, burning, hitting, otherwise physically causing yourself pain, but without the express intention of ending your life, which is the non-suicidal part of that. NSSI is something that a lot of people deal with, and sometimes people with depression will use it as essentially a coping strategy to feel a momentary respite from the deep symptoms of depression that they're constantly plagued with. In other cases, it's an attempt for people to feel control over their life and potentially control over their own body. When I was a pre-professional, so when I was in, I don't know, maybe it was college, maybe even late high school, I read a book called Skin Game by Caroline Kettlewell. And this is a book that I would not recommend somebody who is actively struggling with cutting or NSSI necessarily read, because it is vivid and it could be potentially triggering, but it's a really, really great book to understand what it's like to be somebody that struggles with this non-suicidal self-injury. I pulled a quote when I was going through and preparing for this question, and one of the quotes from that book reads, I cut to quiet the cacophony. I cut to end this abstracted agony, to reel myself back into one present and physical whole. Whole blood was the proof of her tangibility. So I really, really like that quote. It highlights this important aspect of depression, which is the tendency to feel disconnected from life and disconnected from one's own self. So anything that brings that sense of self and belonging within the world crashing back, basically forcing you to ground yourself back in the present, it can be a very seductive coping mechanism. That could be anything from self-harm to drugs or impulsive behaviors. So yeah, this is something that a lot of people with depression do struggle with. So I appreciate you bringing it to our attention here. It's probably been a while since I've gone through the actual diagnostic criteria for major depressive disorder. So I'm going to do that right now. Basically, major depressive disorder is characterized by at least 5 of the symptoms that I'm going to list here, and they need to be present nearly every day for a minimum of 2 weeks to be considered a major depressive episode. And then, of course, at least one symptom has to be depressed mood or loss of interest or pleasure. So the symptoms are depressed mood, diminished interest or pleasure in almost all activities, significant weight loss or weight gain, insomnia or hypersomnia, meaning sleeping too much or sleeping too little, psychomotor agitation or retardation, meaning it's speeding up your physical activity or slowing it down significantly, almost sometimes to the point of being nearly catatonic. And this is something that has to be there nearly every day and has to be observable by others from the outside. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive guilt or excessive and inappropriate guilt. Diminished ability to think or concentrate, and recurrent thoughts of death. So of those, if somebody has at least 5 of them, they're present for almost every day for a minimum of 2 weeks, and there's not something else that would be better explaining what's going on, there's a good chance that they have major depression. So those criteria, for the most part, are pretty straightforward. And it's important to recognize it can look very different from person to person. And there are also a lot of associated symptoms that aren't necessarily part of that formal criteria, but we know they're very common in depressed people. A few things worth pointing out, though. One is that fatigue and depression isn't just feeling tired, like you had a long day at work and you feel tired. It is this overwhelming lack of energy that is very physically impactful. It's a type of bone tired, almost soul tired, where you only know what that feels like if you've been there before. So it's just this all-encompassing, very, very difficult thing to deal with, that just soul fatigue that you get when you're majorly depressed. And then, of course, you can have pains and aches in your muscles and joints. Headaches are common. Also, gastrointestinal issues are common. Now, in your question, you specifically mentioned engaging in that non-suicidal self-injury. And this can be associated with either extreme of the spectrum of feeling way too much when you're depressed or feeling nothing at all. Both can be really scary and terrifying experiences, which could lead somebody to hurt themselves to cope. Research out there estimates that at least 25% of people with major depression also experience what's called dissociation. And this is when you feel disconnected from reality. It could be feeling disconnected from your own body or disconnected from the external world. So when you're feeling disconnected from your own body, this is called depersonalization. And this is when you feel like you're on autopilot, like you're not really connected to your body. You're going through the motions and you know things are happening, but you don't really feel like you're in the driver's seat. And then derealization is feeling like you're disconnected from the world. You could certainly have both at the same time, but when you're disconnected from the world, it might feel like you're looking at the world through frosted glass or from very far away or something like that. And it just feels like you're not actually actively participating in the world around you. It's just happening around you. Dissociative symptoms, which are what these are called, dissociative symptoms, are common in those who have experienced trauma or have other mental health issues in addition to depression. But regardless of why they occur, they can be disturbing and they can trigger somebody to act in a way that tries to bring them back into reality or back into your body, much like the quote that we just talked about. Now, one thing I do not want to do is I don't want to shame you for your self-injury. You've reached for the coping tools that you've had available in those moments. And, in some ways, maybe they've gotten you through. But non-suicidal self-injury is not sustainable and it's not healthy. So we want to try to find some alternatives. So some things that you can do. A good one is to use the same sort of sensory shock, the same sort of thing to get you back into your body, but to find it in other ways. So for example, hopping in a cold shower, right? Very unpleasant to most of us, but it has that same effect of shocking you back into the present. Similarly, if you have access to something like a cold plunge, or if you live near a lake, a cold lake that you could jump into, or a pool, anything like that. Holding an ice cube in your hand is a classic one that people have been using for a long time for dissociation or panic attacks, something that gives you that same shocking sensation. These are great options that typically are not harmful to you. Of course, keep in mind your own personal health. I don't want to encourage you to do something that's a bad idea for you in particular, but generally speaking, these are safe options. If it's the ritual of, drawing something across your skin that makes the NSSI attractive to you, you could try doing something different, like drawing on your skin with a marker or paint instead, and sort of creating art or something that's at least expressive out of the, more negative coping strategy that you've used in the past. Formal grounding exercises are also great if you're experiencing a lot of that dissociation. One that I like to do, I just tend to call it sensory bingo, but there are lots of other names and similar exercises out there. But that's where you go through each one of your senses in turn. What's something that you can see right now? What's something that you could smell? What's something that you can taste? What's something that you can feel? What's something that you can hear? And going through and engaging with your environment in all of those ways. Perhaps the sort of more shocking, cold things are one of the things that you're engaging with there, right? So if it's something that I can feel, maybe I'm holding this glass of cold seltzer water with ice in it, and that's my sensation for, feeling. I hear the clinking of the glass. I have some orange peel in there, so I can smell, a little bit of subtle orange. I have some pictures on my desk and the light in front of me, some plants around that I could look at, and I could, of course, take a taste. So, all of those are things that you can do to, bring yourself back to the world around you. Other ones would be physical exercise. So doing something to actually engage your body. So it doesn't have to be all really unpleasant things like a cold plunge, but, getting some physical exercise, whether that's resistance or cardio, or just literally laying on the floor and grounding yourself on the ground, just connecting to the space around you, pushing yourself into a wall, your back into a wall so you feel that pressure, laying on the ground. Any of these things, again, you're just trying to bring yourself back to your body a bit. I would also highly suggest changing the context in some way, meaning what's happening around you, the situation that you're in, can you change that? So go outside. Talk to another person, change your location or what you're doing in some way just to try to break that pattern if you can. And it can be so hard to engage in these coping skills when you're already feeling exceptionally disconnected from your body or super fatigued. So the idea is just do whatever you can, even if that's literally just flinging open the front door and lying on the ground right on your porch or outside of your house. Take that one step. And with that, hopefully you can interrupt that pattern. You could put a break to that pattern, and that will allow you to do the next thing. So if it's just open up the door, step outside, look at the stars, and take a really big, deep breath, maybe that's enough to kind of bring you back to your body. If it's cold outside, maybe you're feeling that, and that brings you in a little bit more. Then you can go inside and try some of the other coping strategies that you have. Practicing coping skills as well. These things that we're talking about are examples of coping skills, and practicing them when you're not actively at risk, when you're not super disconnected or feeling super depressed or anxious. Practicing them on a normal day when you're not feeling that way can also be a really great way to get mastery over them so that you can rely on them in those moments where you do actually need them. And of course, these are just coping skills for the moment to help you come back to yourself a little, to avoid that urge to self-harm. But we also want to make sure that we're addressing the underlying reason for this, which would likely be the depression. Maybe there's trauma in there as well. Most of the resources that I'm going to talk about here: therapy, medication, groups, self-help, so on and so forth. I would also suggest that you check out some YouTube videos, either specifically about dissociation, depression, or self-harm, or maybe just YouTube videos in general that help you feel better, and just keep them on a playlist so that you can easily access them. Things that are, informational to help you remember what you need to remember in those situations, or ones that are good distractions or that make you feel connected to yourself or to the world. All of these are good options, and a lot of free stuff out there that you can use. Often when people say they have a very physiological depression, medication is a bit more necessary. So when you're talking about it with your provider, make sure you mention about the specific symptoms you're having, because there's different options. For example, a lot of people who have that very physiological depression where it's just no energy, no motivation, feels bone tired, all of that, like I said before, they might find success with something called Wellbutrin or bupropion. And that's a medication that's a little bit different from SSRIs. I believe it's a dopamine agonist primarily, but it's slightly different from something like Prozac or Lexapro. And what it does is it really helps people with motivation and to reduce that sense of what we call anhedonia, which is the inability to really feel anything. So again, there are different options there. But yeah, follow up on those things. Don't just address the top level. The top level is important to get you through day by day. But below that, there's something that's probably driving this. So I really want you to think about how you can start to address that. It doesn't have to be all at once, but pick one thing, maybe two things, and start to go with them. Maybe you get in therapy and you also go to a self-help group, or maybe you decide to take medication and you start really reading books and educating yourself about this. Whatever it might be, just take those steps. You deserve it. So thank you for the question. It's a really great one, and I appreciate you writing in. I'm glad that you're here, that you're still alive, that you're able to write into the show like this. I know it's going to help some other people out there as well. And overall, I just hope that something that we talked about nudges you in a little bit better of a direction. So thank you. And with that, that is everything, guys. I really, really appreciate you watching, and I will see you for the next episode.